Senator, on behalf of Oral Health America and the Dental Trade Alliance, please accept our special recognition. And thank you for all your hard work.
I want to see the text in the right direction. A couple of smiles, gentlemen. Thank you.
Thank you so much.
Well, first, I really want to thank you very much for this recognition, but I really want to thank you for what you do on behalf of the children of America, but on behalf of our healthcare system. It has been noted that you cannot have good health unless you have good oral health. You all understand that. And we in Maryland learned the hard lesson, as you know, in 2007 when the Monty driver lost his life. That story has been told. You understand that he tried, his mom tried to get him to a dentist, could not. He had a need for about $80 of dental care. And as a result of his not being able to get to a dentist to get the issue taken care of, his mother tried, met with social workers, still was unable to get care. He ultimately was rushed to an emergency room, had 2 surgeries costing hundreds of thousands of dollars, lost his life in the state of Maryland, one of the wealthiest states in the wealthiest nation in the world. That was the tragedy. And it underscored the point that oral health has been unattended to, in many cases, too long. Tooth decay is it's the most prevalent disease among children. And if you look at the numbers, you see that it is more prevalent in the minority community. It's much more prevalent in the poor community. It is preventable, and we can do something about it. So in 2007, a commitment was made to change the landscape on oral health care. And we worked, not only in the state of Maryland, but in the United States Congress to change that. And we did. We expanded our federally qualified health centers to include dental care, making it available in the community, getting access. We changed the landscape on information to parents so they knew how they could access dental care. You all helped with the Monty Driver mobile clinic. Thank you. You were responsible. We brought care to the community, and we made a difference. We changed the Children's Health Insurance Program to include oral health care for our children, making it clear that we had to do better. The Affordable Care Act. We changed the national package to include oral health care. And yes, we recognize the fact that we must do more in the disparities in health care and elevated the attention to racial disparities within our healthcare system. We did all that. And in 4 years, Maryland, which was a state that gave us the tragedy of the Monty driver, as you just heard, has been recognized by the Pew Foundation as the best in the country. I have visited the same community in which the Monty driver lived to see now available oral health care in our qualified centers that were not there just 4 years ago. We have changed the landscape. You have made a difference. Give yourselves the recognition you deserve. You've done it. You recognize me, and I thank you for that. You know, senators always like to get an award, so thank you. Sometimes we don't feel like we're loved. During this recess in August, I went back. I went to Maryland every night, but you know, people in Maryland weren't pretty happy about things. So it's always nice to get things that are nice. But I mean what I say, that each one of us can make a difference. Priscilla Ross is here as my staff person on health care. She was the one who said, you know, we could do something really special on minority health. We really could elevate the institute to a full-blown institute under the National Institute of Health, make it a full center. And I thought it was a dream. I didn't think we'd get it done. We got it done. We worked hard on it. A lot of people in this room worked hard on it. So I just really want you to know how much I appreciate what you are doing in this area. Our children are our future, and we are paying better attention to them today than we were just a few years ago. But we're not finished by any stretch of the imagination. Tooth decay is still too prevalent. There's too many, we know it's preventable. So there's a lot more that we still can do. So, and we haven't implemented all these changes yet. They're still scheduled to be implemented in some cases. And we know that there's going to be resource issues and philosophical issues. Our children should not be philosophical issues. Good oral health care should not be an issue that's in debate in America. You're doing something about it, and I'm very proud to be identified with your efforts through this recognition. Thank you all very much.